Hi, everyone. Today, I'm very excited to be talking with Robyn Bergesen, who is a health coach. As a lot of you know, I have a practice here in Austin, and now it's actually moved to the Cedar Park area, where I see patients and do a lot of integrative and functional medicine. So we see patients in person and we see patients virtually throughout Texas. And it started off as an office with a smaller space. And I'm excited because we just moved a couple of weeks ago to a larger space where there's multiple rooms and I can do IV therapy. So that's one of the new modalities we're going to be adding as of next week. But the other modality and the other tool we're going to be using that I'm very excited for and what I'm going to be talking about today is health coaching. And for that, I have joined forces with Robyn, and she's great at what she does. And we're going to be talking about health coaching and everything we're going to be offering in this practice now. So, Robyn, thanks so much for joining me. I'm going to give everyone a little background as far as your introduction goes. So Robyn, her passion for functional health and wellness began over 10 years ago when she was diagnosed with an autoimmune disease. At only 18 years old, she was determined that there had to be another way to live the rest of her life than on countless rounds of steroids and antibiotics. She was lucky enough to find a functional practitioner who helped rebuild her health and educate her on how to maintain this level of wellness throughout her life. Since then, she completed her degree at UT Austin, starting first as a dance major and then switching into sports management with a minor in business. She got her health coaching degree through the Institute for Functional Medicine and has spent the last year developing meaningful relationships with clients and working together towards a positive outcome. She has a strong passion for meeting people where they are and working towards their goals together. So, Robyn, first of all, thanks for joining me on this podcast. And also, more broadly, thank you so much for being a part of my team, which is now more than just me.
Of course. Thanks for having me.
So we want to kind of educate the audience and tell them more about health coaching, what it is and why it's so important. So let's just start there as a basic. What exactly is health coaching?
Yeah. So health coaching, essentially, you work with a health coach when you have seen either a functional health medicine doctor, or maybe you've just decided yourself that you're looking to make some key changes in your lifestyle. Typically, the three categories we see that to being around is movement, diet, and maybe sleep practices or any other habit that you feel like really contributes to your day-to-day life. And those changes could come down from a mandate from a doctor saying, hey, I really need you to get 8 hours of sleep every single night and be moving for an hour every single day. Or you're deciding that by yourself. But those are key changes that we all get very comfortable with our day-to-day habits that are hard to make all at once. You know, if you're getting prescription to change all of those three components at once, it's very hard to kind of muddle through that on your own. So a health coach is your partner in that. They're going to come in, they're going to talk to you about how do we prioritize those things? How are you feeling about those changes? And then we tackle them together. So you're not kind of going through all of that by yourself.
Yeah, in what I'm trying to do, I think it's such an important component and piece. And that's why I'm so excited to have that piece on this team, because the challenge I've noticed when I see patients is that I'll see them and I'll give them recommendations regarding diet, lifestyle. So, you know, and the four areas I focus on are diet, stress, sleep, and movement. And, you know, you can give them recommendations and you can certainly give them meal plans, things like that. But the difficulty for me arises that I'm not able to have that many touch points with them that a health coach can, in order to keep them accountable, in order to keep a check on them, because whenever you're making lifestyle changes, it's so important to have that accountability and to have that person who's supporting you through it, because these are not easy changes to make. These are patterns that people have had for many, many years, sometimes decades. And to just change them after one doctor visit is very, very difficult. And so that's why I think that missing piece for me was always to be working with a health coach so we can be very synergistic in how we treat patients. And now, by the time the patient follows up with me next time, they'll have been seeing you multiple times for regular check-ins. And I think the compliance to certain dietary plans or general diet and lifestyle habits is just going to be much better. So I think that's what's so important, and that's what I was really seeking, and that's why I'm glad that we are now working together.
Absolutely. Yeah, if you think about habits that we've all built over, some of us, decades, that we're very comfortable in, and someone tells you to overnight just change even one of those habits, you're simply not going to be able to accomplish that on your own. It's very difficult to just pull a full 180 and switch on yourself. So health coaches are your partner in figuring out what's difficult about that for you and how can we get there in a step-by-step process.
Absolutely. And I think that everyone, including myself and maybe you, I don't know, but it can benefit from health coaches because, just because we're in the medical field doesn't mean that all of our habits and all of our, everything is always on point. And so, we all go through patterns of extreme busyness, patterns of stress, patterns of, poor diet, things like that. And so having that other person who is a professional, but also someone who can go with you step by step is just so key. So I'm glad to hear
Absolutely.
that. I think just taking a step back, I think it's interesting how practices are structured now. And, in terms of, you don't really think if you were to go back 10, 20 years, how a health coach might fit into that structure, because a lot of those practices were revolved around patients seeing physicians, patients getting prescription medication as, instructions from the physician, and having to just take those medications and follow up. And there wasn't really that big of an emphasis on diet and lifestyle, at least in a structured way. I'm sure there were many practitioners that were doing it, but not so much in, let's put it on paper, let's track how you're doing, and all those metrics. So from that perspective, things have evolved so much to, I think, now health coaches being such an integral part of a functional medicine or integrative medicine practice. And I just like to look at it from the bird's eye view a little bit and see how that change has occurred in the healthcare landscape.
It's really interesting. And the reason that I have enjoyed functional medicine so much is my personal experience was when I was so sick. I was sick for almost a year. And every time I would go to the doctor, sometimes I was in college, I'd have to just go to an urgent care or not a practitioner who had seen me before. And they didn't take any health history. They asked me how long I'd been having symptoms, things like that, but no questions about when was my last round of antibiotics or when did I take my last round of steroids. Medication that can have a pretty serious impact on your health long term. So I was just receiving script after script after script until I found a functional health doctor that was like, we need to back up basically a whole year and take a look at what's happened and really take note of every script you've been given, every symptom you've had, how things have changed over time. And I think that full bird's eye perspective of a patient's full health history, when I do patient intake, I think about like how they were brought up. Were there any conditions that mom and dad had maybe before they were born? We look at family history all the way to any large stressful events that patient's had in their life. We really take a look at the full spectrum to understand what we're looking at, and then how do we move forward.
Absolutely. And I think that when you describe how you were as a patient, I think a lot of people will come see me like that, where they've just been diagnosed with an autoimmune condition. They're young and they were otherwise healthy, and now, they have this. And a lot of times their experience is just what you mentioned, going to physician after physician and not getting more of a comprehensive look and more of a holistic look. And so that's what I really enjoy giving to people. And so I'm curious about your own journey and whether you ever had access to a health coach, because a lot of times, a lot of practitioners do go into the functional medicine space or holistic health space as a result of their own illness. And so I think you very much are in that category. So I'm just curious to hear a little bit more about your illness and that journey.
Yeah, the doctor I ended up seeing did have a health coaching certification as well. Okay. So she really did both with me. So she would take on a way lesser patient load, but she would spend the time we had those check-in calls. We worked together week over week on those lifestyle changes. And I remember she just made things so clear for me in a way that no other practitioner ever had, where she would say, look, if we're working on inflammation levels, for example, let's rate the things that you care about from, 1 through 5 that are going to cause inflammation. And let's go ahead and pick the top one that you can keep. So we're not going to eliminate everything, but we can't have all 5 because your inflammation is simply too high. And having it put in that perspective for me of like, okay, she's not taking away everything, but the numbers speak for themselves. So she's going to work with me to get through it, was really, really beneficial. And I was like, okay, I get to keep something that I love, but these other things are just not helping my body at the moment. And I need to see that. And she did. She checked in with me. We put plans in place for accountability. Health coaching focuses a lot too on using your strengths for getting through some of those difficult things that you are maybe accustomed to having in your life that you're having to let go of. So leaning on my strengths of accountability, of being very determined, things that I have just had in my life as someone who grew up as an athlete. She was like, how do we use those kinds of strengths in making sure that we can be successful with this plan? So health coaching focuses a lot on that too. It's not all about the negative. What are we taking away? It's about what's the positive? What do you already have? What are you already doing? Let's really use that to enhance your life from here.
Yeah, and it's that depth that I really enjoy about a functional medicine practice, in which I can really get into the nitty gritty with patients in a way that no one else has before, and that's what I really enjoy. But obviously, I have to do it in a limited capacity because I might be seeing a patient and then seeing them 6 to 8 weeks later, and so that's why I think the idea of having someone who is really an extension of you in the practice is such a important, powerful tool that they're going to take, all those recommendations and, be that voice for that patient on a weekly basis. So I'm really excited about that, as I think about it more and more. So, to ask you a little bit about the specifics, what does a session or let's say a month look like from the health coach perspective? So say someone is wondering that, they'll see me, and then what will they do in that sort of month afterwards? How often will they meet you, and what will they be discussing at each session?
Yeah. So typically when I work with patients, if I were to kind of on the schedule that you have your patients on today, which I understand is that initial kind of diagnostic session, and then you meet with them about 6 weeks later, 4 to 6 weeks, something like that. With that schedule, I would like to see a patient once a week. Typically we spend anywhere from 45 minutes to an hour together for each session. Because typically what we're going to see is there's going to be a couple recommendations that you've made to them, and we're not going to be able to tackle all of those recommendations at once. If you've made a lifestyle recommendation, a movement recommendation, and a diet restriction recommendation, they're going to come to me probably feeling pretty overwhelmed. So I like to first gauge how they're feeling, maybe which of the 3 they're feeling most ready to take action on. And we're going to start there. What I want to do is I want to build patients up. I want them to feel successful. I want them to feel like they can do this. They can do hard things. They can make these changes. So we start there, and then we check in the next week on the changes that we had agreed upon. How did they go? What didn't work? What worked really well? Do we feel like we can add something else in at this point? Do we want to just do one more week working on, just the movement piece of it? So sometimes patients can work at different paces too, and that's okay. Some patients are ready to hop to the next thing right after that first week, and some patients want a couple weeks with that first challenge, and then we can move on to something else. So my biggest goal is to make sure that the changes we're making are going to be sticky, and it's going to be something that once they're done working with you, once they're done working with me, they're able to maintain so they can maintain their health.
That sounds great. I think that, that stepwise approach is very important. And I'm glad you mentioned that, because I always have it in my mind that when I'm taking a patient through these changes and I'm adding different things, I'm cognizant of the fact that making at the same time a diet change, a lifestyle change, is, whether that's sleep, exercise, whatever that is very difficult to do all together, especially if you have so much stress going on. So taking that one at a time breaks it down to the point that the patient doesn't feel overwhelmed, like he recommended all this and now I can't do any of it, So it's nice to have that stepwise approach. And it's also important for patients to know that they can go a little bit more intense at the start, to where they, at the time that they're seeing me initially, and then, that first month or 2 months, 3 months with you will be more intense. But as they get better and as they make those changes, hopefully, and this is our goal, is that the need to see me and the need to, by extension, see you is less and less. And so that's what we work towards. And so if you have that in mind, then you can put that initial time, money investment into it to know that the outcomes are going to be really good, and then you can decrease that from there on. So I think that that's a really good way for patients to understand that.
I agree. I always joke with patients that when we talk about their treatment plan or how we're going to attack what, has been prescribed to them, I'm like, my goal is for you not to need me. And I feel like that's such a foreign concept because in medicine today, we're so reliant on modern medicine. Like we know we're going to constantly be going back if we're going to need another script, another doctor's appointment, another test. But my take is the sooner I can get you to be self-reliant and able to do this on your own, the better. I'm always here as a resource, but I don't need you coming back. I totally think that you can figure this out on your own.
Yeah, we have so many patients around, just in the thousands and thousands that need really good help. And, if we were just to put them all there, it would be hard to get to each person. And that's why what we're trying to do is trying to help a patient as best as we can to the point that they're able to have a thriving, good life with minimal symptoms, and then really go to the next person. So, that's really what our goal is to get patients out of that kind of sick care system into more lasting health and away from, our offices in terms of needing continuous care. So, absolutely. I'm going to just touch on and tell people how they're going to be able to see you and kind of the practical aspects of that. So right now we're planning to start virtually, and we are basically, we're going to have some more information up on the website where, there'll be a link to book appointments with you virtually and a list of all the prices and things like that. One thing I'm extremely excited about is that we're going to be doing group coaching as well. So we're going to be aiming for creating these groups because, for one, it's really important for people to have support from other patients or other, community support is so important. So even if we can build a very small community of 4 or 5 people doing a group session, they can help each other to make these changes as well, in addition to what you help them with. And number 2 is that if we do a group health coaching, we can also radically decrease the cost of each session. And so, my goal has always been to provide excellent care, but at an affordable price, affordable cost. And so, I'm really excited that for patients who want that one-on-one care with you, they can get that. But the patients that want, a lower cost group model with additional support from other folks, they get that as well. So I'm really excited to roll all of these out. There's a potential that down the road we do in person, but we're not there yet. Right now we're starting virtually. And I'm excited about that because I think that we have tremendous potential to work together as a team and really help patients in a way that's going to be unique. So that, in addition to IV therapy, which is another really great modality that we're starting very soon, are all things to be really excited about.
Yeah, I agree. I think the group and the individual coaching both have such unique, I think, needs, and they can be for specific people. I love the group coaching for if we're prescribing, let's say, a specific diet change, and we feel like it's a difficult one to make, and we can create a group coaching environment around it, and they can share recipes or how they're tackling that specific change. They can help, hold each other accountable, check in, text each other, maybe like every morning, say like, how did you do last night? Was dinner good? I think just the more support you can get from a group environment can be really, really helpful if you're facing the same challenge. challenge. But on the flip side too, I understand that we are talking about really personal topics a lot of times for people. These are deep-seated habits that we've built up for, again, possibly decades and decades. So sometimes you're not ready to share that with a full group of people, and that's more of a one-on-one conversation to have. And a lot of times I find that that's a safer place for people when they're at least getting started with health coaching. So yeah, I'm excited that we're going to have both as options for everybody, and I hope to get to meet many of you.
Awesome. So are there any last words that you want to leave the audience with?
I think I know that health coaching is kind of a new thing that's being offered in medicine as a whole, and specifically functional medicine, but it pairs really, really well. I have seen some of the most radical changes for myself and also patients that I've had the pleasure of working with when we're just able to have a few meetings to really get past that first big hump. I think it's like any change is hard for all of us in all aspects of life. And I'm here to be a support system to help you understand your amazing strengths and how you can play those into these difficult times to really be successful. So, yeah.
That's so well said. And so thank you, Robyn, for joining me today on this and talking about health coaching. And thank you so much for joining my team and, being able to expand on that and provide patients with even better care. So I appreciate you.
Absolutely.